Welcome everyone. Today we are going to discuss the anatomy of the ureter. We have divided this session or this topic into two sessions. This is the first session, there will be another session. Hi, welcome all. My name is Dr. Ankit, your anatomy educator in our Unacademy platform. Let's start the session. Before we start, there are a few updates. There's an unlock 20 feature that is going on, and you can save your 20% on NEET PG Iconic subscriptions, and also you can save 35% if you go for the plus subscriptions. These are all the duration wise for 4 years, from 6 months to 4 years, same for all these. And this is the offer price. These are the various savings. You can unlock them by using the code. The code which you can use is Dr. Ankit 10. Dr. 10 is the code that you can use. You can unlock these features. Right? This is valid till Friday only, till 26th of August. So remember this. This is a very good offering. Personal, and all of you should go for it. Apart from this, there's a new integrated and system-wise batch that started. It's going to start from 25th of August 2022. All the faculties you are seeing from different subjects, all the subjects are going to be integrated, meaning by that, for example, anatomy would be integrated by subjects like ENTs, orthos, orthopedics, etc., etc. So likewise, other subjects are going to be integrated. So that's going to be very important system-wise and integrated batch, which is, I guess, the best feature of any medical studies. Apart from this, we also have this batch which is going to start integrated concept coverage, and that's again going to start on 25th, and this duration of this batch is going to be of 5 months. The various modules given over here: integrated clinical revision, MCQs, dual educator classes, in class doubt solving. And this module 2 like PYQs discussion will be held on month of October, November, and the image based question will be held on the month of December 2022. So enroll it, and you get the best of it. Right? There's also a Q bank too. Now this is updated Q bank, very important Q bank with all the updated questions and the explanations. Highlights is there are 18,000 plus brand new questions. So I think that all the topics are going to be covered in this particular Q bank. 75% case-based questions, clinical and integrated, a detailed answer explanation are provided. Performance analysis is also available. So that is a use of technology also, that you get an analysis of the performance. And subscribe now for this. Let's start the session. The session was about anatomy of the ureter part. First part, anatomy of the ureter. Let's start with it, and how to go with it is that we have to look for the general considerations. We are discussing the topic. The topic is ureter. Let us start with some of the general considerations over here. Ureter. Ureter, we all know it's a muscular tube which goes from kidney to the bladder. Which goes from kidney to the urinary bladder. Right. There are a couple of things. Kidney being a retroperitoneal structure, ureter will also be a retroperitoneal structure. That it lies behind the peritoneum, the abdominal part. But as you will see, as we go on, that ureter has basically two components. One is the ureter which is lying in the abdomen, so we call it as the abdominal part, and there is also a part of the ureter, or you can say the distal half of the ureter, that is lying in the pelvis, so we call it as the pelvic part of the ureter. So there's the upper abdominal part and the lower pelvic part. These are sort of equal in length. Talking about the length of ureter is roughly around 25 to 30 centimeter total length. Half of it lies in the abdomen and half of it lies in the pelvic part. Some textbooks is also called as a renal pelvis part. The part of the ureter, or you can say the upper continuation of the ureter, is known as a renal pelvis. If you look at the kidney over here, what comes out of the kidney is not the ureter, it's the renal pelvis. It's the upper dilated part. So this dilated part also may be sometimes called as a upward continuation of the ureter. And ureter actually starts near the lower pole of the kidney. From here the ureter will actually start. So it will first have an abdominal course, and then to move to the pelvis, it will have a pelvic course. So half of it lies in the abdomen and half of it lies in the pelvis, and finally it terminates into the urinary bladder. Clear? It is retroperitoneal structure. It is retroperitoneal in structure, and the main function is the conduit of urine. So the other point which I want to make over here is that it's not just a simple pipe which is carrying the urine from kidney to the bladder, but it's quite a muscular tube. And the urine in the bladder is being thrown in the form of jets. The urine in the bladder is thrown in the form of jets over here. It is also collected from here. Right, there's also a pacemaker system that we'll see, and then it is thrown into the bladder in the form of jets. This was about general consideration. I repeat again, it is a muscular tube lying retroperitoneally, approximate length 25 to 30 centimeter, proximal half in the abdomen, the distal half in the pelvis. The abdomen part is retroperitoneal and the pelvic part again will be below the peritoneum. It will be below the peritoneum. Suppose in a rough way, if we consider this as the peritoneum, then this peritoneum will continue from here. This is the pelvic part and this is the abdomen. As you all know that the pelvic organs are supposedly infraperitoneal, so they are below the peritoneum. So same goes for the ureter. Moving from the general considerations, if we come to the talk a little bit of its what we can say as a development part, development, because that is also important. Development, or we can say embryologically, what is important for the ureter? Let us talk about it. Embryologically, because there are going to be various congenital anomalies also, which we'll discuss. So about the embryology. Ureter is derived from ecto, meso, endo. These three things are there. Ureter comes from the mesoderm. It comes mainly from the mesoderm part. There's a mesonephric duct. There is a mesonephric duct, and this mesonephric duct is going to give a diverticulum. The diverticulum which arises from it is known as a ureteric bud. It's known as a ureteric bud, and this ureteric bud is the one that's going to form the ureter. Now, if you talk of the development, not just ureter, because the ureter is connected to the kidney, so it is quite in relation to the kidney, obviously. If you talk of the development of kidney also, then kidney developmental wise over here, just giving you an overview, is coming from the metanephros, that is known as the metanephric blastema. Metanephric blastema, and this part of the development process will give rise to the excretory part of the kidney, meaning by all those tubules, and then it has a collecting part. That is collecting part that is formed by this ureteric bud, the same ureteric bud. So this ureteric bud will actually go inside the kidney. It will form the calyces of the kidney. It will form the even the collecting tubule of the kidney. So this ureteric bud is known as the collecting part of the kidney. So you can understand that this collecting part of the kidney is the same as the ureteric bud. So this ureteric bud, same over here. So this is the ureteric bud over here, right? And let me tell you that in form of embryologically, it forms as a two fusiform swelling. So there are two dilatations in the ureteric bud, which will give rise to, there are two dilatations in this tube, which will give rise to the, what we normally call it as anatomically the three constrictions. So we talk about it at the time of constrictions, right? So developmentally, it is a diverticulum from the mesonephric duct, and this diverticulum also will, it actually gets absorbed into the bladder. It actually gets absorbed into the urinary bladder, what we normally call in the urinary bladder as the area for the trigone. It's the area for the trigone. So basically, mesonephric duct diverticulum and mesoderm is the development, and we'll subsequently talk about this congenital anomalies. So this was the developmental part. Now let's talk about the histology. Histology, why histology over here? Because histology is all about, let me call it as a functional histology. We have a functional histology. What does it mean? It means that you should know the function of an organ, and then you will know about the histology. As I already told you, it's a muscular tube. So there is obviously going to be a lot of muscles around it. There's going to be a lot of muscles and a lot of thick muscles. You'll see. If I talk about it, then muscle part, then in the muscle part, the upper part of ureter, has a outer circular muscles and an inner longitudinal muscles. The upper part of the ureter. As you go to the lower part of the ureter, in addition to this, they also have an outer longitudinal layer. So in the lower, or the, against the distal part of the ureter, there you have an outer longitudinal, middle circular, and an inner longitudinal layer. But mind you that these layers are not easily distinguishable from each other. They are sort of spirally and they are sort of fused to each other. So you can't separate them easily. But yeah, these are the various layers over here. Why? Because it is a muscular tube and there's a lot of peristalsis going on. You have a whole ureteric peristalsis. So wherever there is peristalsis, say for example the gut, they have different muscles. Gut, you have two strata of muscles, a muscularis, muscularis mucosae in the mucosa part, and a muscularis propria or muscularis externa in the outer part. Same over here. Now it has a lot of muscles, as we can see. But what would be lining the lumen of the ureter? Obviously, there has to be some epithelium, and that epithelium is known as urothelium. So you also see a urothelium also known as a transitional epithelium. That is known as transitional epithelium. So this transitional epithelium will be located on the inside of the ureter, and lining this epithelium will be the muscle, and between the epithelium and the muscle there has to be some lamina propria, also the loose connective tissue. Has to be some lamina propria, the connective tissue which is holding the blood vessels and the lymphatics and the nerves, which we talked about. But what lies outside the muscles? Outside the muscles there will be layer, we can simply call it as adventitial layer, which will be having all of those again the connective tissue, the supporting tissue lining outside the ureter. So histologically this is what we are going to see, and let us see over here histological image. This is a histological image over here. This is where you are seeing the lumen. Now lumen looks star shaped. Lumen looks star shaped. Why? Just imagine the esophagus and this over here. When the urine is not here inside the ureter, it is like this. Lumen is star shaped. When the urine goes inside it, then obviously the lumen is going to dilate. That is why the epithelium is transitional. This epithelium over here has to be the urothelium. Just writing urothelium, it's another word for transition epithelium. This is a urothelium. Now this LP is the lamina propria, and you can see the lot of connective tissue over here. And outside these are L for longitudinal and C for circular muscles. There are a lot of circular muscles. And as you go lower down into the ureter, you have having an extra group of muscles lying outside. Why? Because now the urine has to pump into the bladder. Urine has to be pumped into the bladder, so more force is needed. The distal part, you have more of the muscles, right? And outside this is the adventitia part. This is the adventitia part, again the supporting tissue lining outside the muscle. So this is what the ureter looks like, and you can see a vessel over here in the adventitia part. Vessel over in the adventitia part. Remember, we'll talk the blood vessels also. There are a lot of blood vessels lying in the supplying the ureter. Right. So moving from histology, now we come to the parts of the ureter. As I already told you that there are two major parts. One is the abdominal part of the ureter. One is the pelvic part of the ureter. Right? So first, or you can say abdominal part of the ureter is also basically known as the proximal part. Length is around half, so you can imagine around 12 to 15 centimeter would be the length of the abdominal part of the ureter. Let us see about the course, because here there are 2-3 things which you need to know in ureter. Is what is its course and what are the important. I am not saying all the relations because that is not important. I am talking of important relations which are going to be clinically important for your MCQs and for your future medical career, right? So let us talk about the course of the abdominal part of it. We are focus only on the abdominal part. I am writing over here approximate length is 12.5 to 15 centimeter, depending on different persons or different height. There are different parts of this. Let us look over here at the image. There's an image over here which is showing the course of the ureter. It's showing us the course of ureter. Just a second, let me just highlight it a bit. You can see that these are the two kidneys, and there's a renal pelvis over here. What is coming out of the kidneys, the renal pelvis. At the lower pole of the ureter, somewhat over here around L2, you have the starting of the ureter. Now ureter course, you see that it is lying behind the peritoneum, and here it is lying in front of the transverse process of the lumbar vertebrae. It lies very in front of the transverse process of the lumbar vertebrae. Then it goes down, and as it crosses the sacroiliac joint, now this part is the pelvic part. This part will be now the pelvic part of the ureter. Pelvic part, that is the abdominal part. Of course, some things we already know, that this ureter is retroperitoneal, that we already discussed. It is retroperitoneal. Of course, simply this in the abdominal part, it simply goes down vertically in front of the transverse process of the lumbar vertebrae. Now, why is this important? I will tell you in the applied part, but have a look at quick understanding. If you take an X-ray of the QB region and you suspect a ureteric colic by the symptoms and signs of the patient, and therefore, if you take an X-ray, you will see the bones. And in front, if you go down in front of the transverse process of the lumbar vertebrae, you see any opacities over there, you may suspect a ureteric colic, a ureteric stone at that location. That will tell you about the abdominal part. So abdominal part is retroperitoneal. So let us see the important relations. So what lies anterior and posterior to these? Let us deal with it. Here we can take a note of it. That what are the relations of the abdominal part of the ureter. So talking of the relations, let me start with the posterior relations. First is the posterior relation. What lies behind the ureter? Not in front, but behind the ureter. So behind the ureter, you've seen that there was a transverse process. But does ureter lie in front of the bone? What comes from the bone, which is a muscle which comes from the bone. So posterior relations are the psoas major muscle. Which muscle? The psoas major muscle, because that is a muscle of the posterior abdominal wall. And this muscle takes origin from the lumbar vertebrae. So this muscle lies behind the ureter. Remember, behind. Now, if I ask you that in the psoas major muscle, deep to it lies the lumbar plexus of nerves. But in front of the psoas major, the only one nerve comes out that will also lie as a posterior relation of the ureter on both the sides. Which nerve is that? That nerve is your genitofemoral. So genitofemoral nerve also lies posteriorly to the ureter on which side? Both the sides. Both the sides. Right? So posterior relations are mainly psoas major, genitofemoral nerve, and obviously we can talk about these transverse processes of the lumbar vertebrae. Remember, these are important posterior relations. Now, talking of the anterior relations, because ureter itself is retroperitoneal. So posterior to ureter will be obviously retroperitoneal structures or the posterior abdominal wall. What are these basically? These are basically the posterior abdominal wall for the abdominal part. Now come to the anterior relations. In the abdominal part, what lies anterior in the abdominal part of the ureter? Anteriorly, obviously, there is going to be peritoneum, but other structures are also going to be there. So what are the anterior relations? Let us understand this. Anterior relations slightly different on the right and left side. So let me talk of the right ureter over here and say the left ureter over here. Right and left ureter. Let us deal first with the right ureter. Let us first deal with just a second, the right ureter. So obviously both of them you have the peritoneum. It is retro, so peritoneum lies anterior to it. Same over here, again peritoneum. Okay. Then what lies in front of the ureter? In front of the right ureter, or both the ureters, there are gonadal vessels. They pass in front of the ureter. Please understand this. There on the right side, there is right gonadal vessels. And the left side, there is the left gonadal vessels. That is also common, right? That is also common. Then talking about other vessels. On the right side, there will be vessels which are going to the right side of gut. What are those? Those are your ileocolic and right colic vessels. So you have ileocolic and right colic vessels. Same on the left side, there is not left side, there is no ileocolic, but there is a left colic vessels that will supply in the descending colon, left colic vessels. Right. Now these are the vessels lying in front. What else could be there? There is peritoneum. What else lies? In the beginning of the ureter, there is duodenum. So there can be second or third part of duodenum which lies in front of the right ureter. I'm talking only of right ureter. They're not found in the left ureter, but right ureter. Then what else couldn't be in front of right ureter? There is a root of mesentery. If you remember, root of mesentery went from DJ flexure to the right sacroiliac joint. So it somehow crosses the right ureter. So there's also going to be the root of mesentery. It's also going to the root of mesentery. So root of mesentery is there. Then there is this duodenum part, second or third part, duodenum lies in front of it. Right? Then there's gonadal vessels, ileocolic and right colic vessels, peritoneum, and all these are structures lying in front. Then there could be obviously some part of the gut, mainly ileum or jejunum, mainly ileum, that could be lying in front of it. So loops of intestine. I'm just writing loop because if there is a root, then there can be loops of intestine also. Now come to the left part. Left part, till now things were common. What is different on the left part? Left part, there's any duodenum, not much of duodenum is there. Then there's any root of mesentery, no root is, but there is some other root. If you go down on the left side of the gut, there is a sigmoid colon, and then there is a root of sigmoid mesocolon. So this root of sigmoid mesocolon that lies over there, and there is a intersigmoid recess. There is a intersigmoid recess that lies over in front of the left ureter. So these are relations, important relations in front of the right and the left ureter. Do remember, ureter is retroperitoneal. Ureter is retroperitoneal. So behind it, there will all be the posterior abdominal wall, and in front of it, there will be peritoneum and other structures lying in front. Right? And ureter is a primary retroperitoneal. That is why these duodenum, which are themselves secondary retroperitoneal structures, are lying in front of ureter. Duodenum, which are secondary retroperitoneal structures, are lying in front of the ureter, which is itself primary retrobladral like the kidney. Okay, so these things are important. This was the abdominal part of ureter, and here you can see abdominal part of ureter. Now we come to the have a figure. Imagine this is showing you the posterior abdominal wall. These are all the lumbar vertebrae which you are seeing over. These are all the lumbar vertebrae. And this was a muscle which I was discussing, that was the psoas major. This lies in front or behind the ureter. It lies behind the ureter. This is the posterior abdominal wall. This image is basically the posterior abdominal. And this is on the right side as shown the transfer processes. On the left side, the transfer processes are hidden by the psoas major. And if you say L5, 4, 3, 2, 1, from here the hilum of the kidney will be hilum of the left kidney, and this over here, imagine, this is where the ureter is passing down. So it passes in front of genitofemoral nerve also, because that nerve lies in front of this. Okay, so this is the left ureter, and the right arm will be obviously on the right side. Moving from the abdominal part, we now come to the pelvic part of the ureter. Pelvic part of the ureter. What happens in the pelvic part of ureter is that now the ureter has gone down. If we talk about the course of ureter, the whole ureter, we have seen that how it vertically went down in the abdomen. Then from abdominal part, it went close to the sacroiliac joint. Close to where? To the sacroiliac joint, right? And as it went close to the sacroiliac joint, now what will happen is that it has to reach the ischial spine. How, sir? Let me show you again over here. Can you see this? This bone landmark is what? This bone landmark is the ischial spine, right? This is the area from a sacrum, that is ilium. This is a sacroiliac joint over here. This is the whole sacroiliac joint. Now it has to reach the it has to reach below into the ischial spine, and then it moves anteriorly. This is the bladder over here, shown as the bladder over here. So what now happens is that from sacroiliac joint, as it has to reach the ischial spine, it passes laterally into the, you can say, the border or the upper border of the upper or anterior border of the greater sciatic notch. From there, traversing through the greater sciatic notch, because we know the greater sciatic notch ends where? Into the ischial spine. Then you have a small lesser sciatic notch. By this, it reaches the ischial spine. Then from ischial spine, there's a sharp change. What is that change? The change is that from ischial spine, the ureter in both male and female, that now starts to run anteromedially. Anteromedially like this, and then it has to reach where? It has to reach the base of the bladder, the base of the urinary bladder. You'll look at the course, but just telling you the course in rough so that you know the basic relations. So I repeat again, this from the abdomen it went down, reached the sacroiliac joint. Now it has to reach the ischial spine. So it goes via the greater sciatic notch. Because you see, greater sciatic notch is filled already by the piriformis muscle. So it can't pierce the piriformis. So it goes just by the greater sciatic notch, reaches the ischial spine, then it turns anteromedially. Till now it was coming down. Now it turns anteromedially, and then it reaches the base of the bladder. Now this whole course again sort of divided into parts. Let me tell you what. When it was coming down through the sacroiliac joint into the greater sciatic notch, till it reached the ischial spine. So this pelvic part of ureter, till it reaches the ischial spine, it is this one is the first or the vertical part. That is the first or the vertical part of the ureter. I hope you got the point. This is the whole first or the vertical part. Right? Then second is the part when it went anteromedially. Antero and medially. So this is the second part. Second part is anteromedially, or you can also call it as an oblique part. Oblique because it's slightly oblique. The third part of the ureter, because there is around a couple of centimeters, around 2 centimeters of ureter that goes through inside the urinary bladder. That is known as the third part, also known as intravesical, means inside the urinary bladder. That is around 2 centimeters. So for 2 centimeters, the ureter is going through the bladder. Why? We'll talk about it, because that prevents the reflux of the urine back when the bladder contracts. The bladder contracts for micturition. Urine should not pass back into the ureter. That is also the third part. This is also an oblique part. So these are the 3 parts of the pelvic part. And now we'll discuss about this in the next session. We'll continue from here, and we'll discuss from here into the next session. I hope you enjoyed till now, and Let's see.